concur. I welcome the opportunity to discuss long COVID health services, and I thank you, deputies, for tabling this private member's motion. And I'm responding to the motion on behalf of the Minister for Health, Stephen Donnelly TD, and the Government. I am very aware that long COVID is having a devastating effect on people, and I, the Minister for Health, and the Government are committed to ensuring that care is in place for those who need it. And €2.2 million was allocated for 2022 to put in place a service to support those with long COVID. And Budget 2023 will facilitate an overall investment of an additional €6.6 million for the further development of long COVID services to ensure a full national service is in place. As you all know, COVID-19 is still a new disease, so information on it, its features and its course are still emerging. The natural history, clinical course and consequences of COVID-19 are still not completely understood, although a lot of work is underway nationally and internationally to improve our understanding. Fortunately, most people with COVID-19 recover well, but a proportion of people report ongoing health issues. Long COVID includes a wide range of persistent or new symptoms that develop after infection with COVID-19. To aid recognition and management of those affected, the World Health Organization, through a global consensus process, proposed a working clinical case definition. And the WHO defines long COVID as occurring within 3 months of the onset of COVID-19, with symptoms that last for at least 12 months, and it cannot be explained by an alternative diagnosis. The common symptoms identified include fatigue, shortness of breath, cognitive dysfunction, and others which generally have an impact on everyday functioning. Symptoms may be onset following initial recovery from an acute COVID-19 episode or persist from the initial illness symptoms, which also fluctuate or relapse over time. The World Health Organization note that this definition may change as new evidence emerges and our understanding of the consequences of COVID-19 continues to evolve. So you can see addressing long COVID-19 is complex. The symptoms and duration and severity of symptoms are very varied, as are the need for care. Two people's experience of long COVID can be quite different. There is also a lot of uncertainty in the international literature about how many people experience these prolonged symptoms. And according to the WHO, it is estimated that 10 to 20% of those with COVID-19 develop a variety of mid and long-term effects like fatigue, breathlessness and cognitive dysfunction. A recent publication in the Lancet Medical Journal indicates that at present at least 17 million people are estimated to have long COVID in Europe. People who have COVID-19 are being followed up, cared for by their GP or in hospital settings as clinically appropriate. Treatment is currently focused on management of specific symptoms. Those in the community who are concerned about persistent COVID-19 symptoms should contact their GP in the first instance. Building on the services already in place to support patients with post-acute and long COVID symptoms, and as the deputies will know, an interim model of care for long COVID has been developed and is currently being implemented by the HSE to support those who are in need of care. The model of care involves the expansion of some existing services and establishment of new services across a number of settings, including GPs, community services and acute hospitals. The first priority is to ensure there are long COVID and post-acute COVID clinics operating within each hospital group to ensure a national service. To date, 5 new post-acute COVID clinics have been established, including clinics in University Hospital Galway, Mater University Hospital and Connolly Hospital Blanchardstown. And these post-acute clinics are managing patients between 4 and 12 weeks after initial onset of infection. Long COVID clinics are managing patients 12 weeks post-onset of infection, and 5 new long COVID clinics have also been established. These include St Vincent's University Hospital, Beaumont Hospital and University Hospital Galway. Both Tallaght University Hospital and St James Hospital are operating combined post-acute and long COVID clinics, and a dedicated long COVID clinic and a post-acute COVID clinic are due to be opened shortly in Cork University Hospital, and the HSE is continuing to work with Letterkenny University Hospital and Limerick University Hospital to progress the opening of clinics at both sites. There are some additional hospitals which are operating clinics on an ad hoc basis outside the model of care, in addition to the clinics mentioned above, and these include the long COVID clinic in Mater University Hospital and post-acute clinic in St Michael's Hospital, Dunleary. However, the HSE is continuing to work towards aligning all HSE clinics towards a national service. To support these services, there is a tertiary neurocognitive clinic in St James's Hospital, led by a consultant neurologist with background in neurocognitive disorders, which is accepting referrals from long COVID and post-acute clinics from around the country. I know that concerns have been raised by some colleagues around the fact that all clinics may not be fully staffed. However, I would like to reassure colleagues here today that this does not mean that these clinics are not operational and actually seeing patients. It is true that recruitment is ongoing at some of the clinics, but I can assure you, deputies, that they are operational, albeit not fully staffed as per the interim model of care recommendations. And where no staff has been recruited, patients are being seen by existing staffing and resources. And the assignment of additional staffing and resources will support and enhance the work of existing clinics operational under the model of care. As you may all know, that the care for those experiencing long COVID clinical input is provided as needed, depending on symptoms, by a range of healthcare professionals. Therefore, clinical leads representing respiratory medicine, infectious diseases, neurology, mental health, allied health professionals, community services and general practices have been appointed, and recruitment of additional posts, including consultants in the area of infectious diseases, respiratory medicine, psychiatry and neurology, allied health professionals and clinical psychologists and administration will continue in 2023 to staff the full service. These interdisciplinary teams guide and support patients through all aspects of recovery, supporting care for a range of primary symptoms. And the development of effective therapeutic options for patients suffering from long COVID poses significant challenges. There is no proven drug therapy or evidence-based treatment options for long COVID per se. Current treatment consists of diagnosis, advice and support, and onward referral to additional services as required. This includes ruling out and managing, if identified, other underlying medical conditions such as anemia, asthma, sleep disorders, heart failures, and supportive care and rehabilitation if indicated through our allied health professionals such as physiotherapy, occupational health and psychological medicine. Again, I want to assure you, deputies, that the Minister and I will continue to develop an understanding of the implications of long COVID and prioritise support for those affected by long COVID to optimise health outcomes for those impacted. Deputy Canny, you raised the fact that children are impacted by this, and you want more dedicated specialist-led teams, and I agree with you. And Deputy Murphy, you also called for an independent review and also a restricted covenant on those that are working for the HSE, and I will bring that back to the department. But also you raised the fact that that fatigue is affecting 21,000 people, and regarding staffing levels. And I think when you look at so many people in Europe, I think that those figures are quite correct. And also Deputy Lowry, they talked about Emily, that teenager Emily, and the challenges he's faced, and Deputy Fitzpatrick, you talked about Liz and long COVID, and they are stories that I'm hearing in my own clinics, and my own testimony around the country. And I want to thank you and Deputy Nocton for raising this issue, along with your other deputies, and the Government will not be opposing this motion.